Improving infant well-child visits from 0 to 15 months, getting started on quality improvement. Hello, I'm Jane Taylor, Quality Improvement Advisor. Well-child visits can improve children's health, support caregivers, and prevent injury and harm. The American Academy of Pediatrics and Bright Futures recommend 9 well-child visits in the first 15 months of life. When children receive the recommended number of visits, they are more likely to be up to date on immunizations, have developmental concerns recognized, and are less likely to visit the emergency department. However, many infants do not receive the recommended number of infant well-child visits. In this video, I will share quality improvement methods that will help your Medicaid and CHIP agency get started on a program to improve infant well-child care in your state. A great way to begin any quality improvement project is with an aim statement, identifying what you want to improve. An aim statement identifies key parts of your project. What do you want to achieve? Who is your population of focus? How will you measure improvement? And by when do you want to see improvement? A good aim statement will help keep you and your quality improvement partners working together towards the same goal. Here's an example aim statement on improving infant well-child visits to help you get started. By a specific date, the state Medicaid and CHIP program will improve the infant well-child visit rate among beneficiaries 0 to 15 months from a baseline rate to a new, higher rate. The aim statement anchors the beginning of the driver diagram. A driver diagram is a quality improvement tool which organizes evidence-based processes or systems that can drive the change needed to help you achieve your aim. Next, you identify the primary drivers. These are key processes, structures, or norms in your system that need to be considered to achieve your aim. For example, one of the primary drivers for improving the rate of infant well-child visits highlighted here is collaboration. Secondary drivers are the places, steps in a process, time-bound moments, or norms that identify the opportunities to produce improvement. The secondary driver highlighted here is cross-agency managed care and provider partnerships. We'll say more about these highlighted drivers later in this video. Secondary drivers lead to change ideas. Change ideas are activities supported by evidence, experience, or expert opinion. Building off the success of others will help you achieve your aim. Another tool that may help your team identify potential change ideas is a process flow, a visual display of the steps in a process. Seeing all the steps that are part of your current process can help you see what happens between the beginning and its end. You may find processes that are taking too long or not happening at all. Process flows can help you see opportunities to improve the process and in turn improve your aim. You will find an example of a driver diagram and change ideas table to improve infant well-child visits, as well as other resources on Medicaid.gov. How can you get started on a change idea for your Medicaid and CHIP program? Although it may be tempting to go big, making a change for the whole state, it's best to start small and test your way into the most effective program and policy improvements for your state. Using small tests of change will enable you to determine whether an idea will lead to sustainable improvements in your program and with your beneficiaries before enacting policy changes. An effective tool for testing change is the Plan, Do, Study, Act, or PDSA cycle. The PDSA cycle helps you learn whether a change idea will work for circumstances in your state. Let's plan a Plan, Do, Study, Act cycle, a PDSA cycle, by testing an idea from the driver diagram and change ideas table on improving infant well-child visits for children 0 to 15 months. We begin with the secondary driver we highlighted earlier, cross-agency managed care and provider partnerships, and then review and select an idea from the change ideas table. Some states have worked with their public health nurse home visiting teams to discuss preventive care with families and help schedule well-child visits if needed. The first step is to plan. Start by asking, what question do you want to answer with this small test? For this PDSA cycle, your question might be, would discussing infant well-child visits and confirming the next appointment during public health newborn home visits improve infant well-child visit attendance? Next, decide what you will test, who will conduct the test and the subject of the test, and what tools or resources are needed to conduct the test. One of the most important elements of the plan section is to identify what data you will gather to learn whether the idea has promise. Did it work or not? Develop an approach that keeps the data collection simple and quick. Try not to use administrative claims or other data with lag periods. The data don't have to be perfect. You just need to learn quickly whether and how this small test worked. Finally, make a prediction. What do you think will happen as a result of your PDSA? Making a prediction will enhance your learning. When you've completed your plan, you're ready to do or conduct the test. In our example PDSA, did Kristen discuss well-child visits during her next 10 newborn home visits? Was an appointment confirmed or made during the newborn home visit? Next, study the data to understand the results of your test. Did your test go according to plan? What did the data tell you? How do your predictions compare to what happened? What surprised you? The final phase of the PDSA cycle is to act on what you have learned from the test. In most cases, this means planning the next iteration of your test based on what you have learned. For example, in the next PDSA cycle, test how to remove a barrier that you learned about. Or you can test the change idea with a different population, in a different setting, or with more providers or beneficiaries. You could even test several things by doing concurrent PDSA cycles. In this example PDSA cycle, Kristen was scheduled to see 10 newborns in 3 weeks, and she was able to discuss the importance of infant well-child visits during those home visits when she remembered. There was one visit where there were many other issues and she was too rushed to discuss the next well-child visit. And there was one visit she couldn't complete and a colleague stepped in. The PDSA data showed that for all the home visits where Kristen was able to discuss and confirm the next infant well-child visit, the baby was also able to attend. Through the PDSA cycle, the team learned that using a public health nurse to discuss and confirm infant well-child visits was a successful change idea that helped to increase rates of well-child visit attendance in the first month of life. However, when Kristen was rushed or when she wasn't available, a discussion about the next infant well-child visit didn't occur. The appointment was not confirmed or made, and both of those newborns didn't receive a visit by their first month of life. For the next PDSA cycle, the team decides to use a checklist that includes discussing the importance of preventive care and confirming or making the newborn's next appointment. The QI team also decides to include another Junco County public health nurse and expand the PDSA to the next 25 newborns. Remember that testing ideas concurrently will accelerate your progress. Continue testing and learning about your change ideas by addressing barriers to improvement and over time increasing the size of your tests. For example, if you started by including 10 newborns, test next with 25 and then 125. As you conduct your PDSA cycles, create run charts to visualize your data. A run chart is a graph that shows performance of a process or outcome over time. Run charts often show data in week or month intervals. Displaying data over time will show you the impact of your change idea and whether it is producing the desired results. The run chart shown here captures the data from our PDSA. For Junco County, the baseline rate of newborns with at least one visit in the first month of life was 32%. When Kristen started discussing and confirming an infant well-child visit, the rate jumped to 60%. And when another public health nurse, Olivia, was added to the test, the rate went to 72%. When Kristen and Olivia recognized how many Medicaid families needed help addressing barriers to their appointment, a third PDSA working with a dedicated state case manager helped them reach their goal. When you have confidence that your change idea will reliably improve infant well-child visits, you are ready to implement it broadly in the system where you conducted your testing. Good implementation includes getting buy-in from leaders and others involved, including the people receiving the benefit. You will want to make sure that the cost of failure, either financially or in terms of the goodwill of your partners, is low. Broader implementation might require changes in behaviors, policies, or procedures, and might include training staff and securing more resources. After successful implementation, you're now ready to create a spread plan, a plan for expanding beyond the initial setting or population you tested into new settings. For example, testing in a new county or a different population. As you expand, continue to collect data and monitor progress to make sure your change idea continues to have impact and the outcomes are sustained. What I've presented here, identifying an aim statement, developing and conducting PDSA cycles, and implementing and spreading change ideas, is called the model for improvement. It is one of the best ways to transform ideas into strong programs and policies for Medicaid and CHIP beneficiaries. To learn more about the model for improvement and to request quality improvement technical assistance for your state's Medicaid or CHIP improvement project, reach out to CMS through the Quality Improvement Technical Assistance mailbox. That mailbox is Medicaid CHIP QI at cms.hhs.gov. For more information and additional resources, scan this QR code to go to the Improving Infant Well-Child Visits Quality Improvement Technical Assistance webpage. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense.